This is Bishop Dr. Truman Burst. Master Herbalist, coming to you from Good Shepherd Ministries.
Available, what it's doing, why it's doing it, and you can just start adding more and more support and understanding the situation more and more until you know, and with prayer, you know, God is good. Most people are telling me that they don't have their problems anymore.
Yeah.
Because that just, okay, so that takes care of that heart situation. Now let's get to the kidneys, okay?
Okay.
Because you understand what we've got going there, and that's all on herbalhealthreview.com under heart. Well, under you click on common conditions, then you go to heart, and there's where all that information is.
Perfect.
Okay. Okay. Now.
It's literally all right there. It's awesome.
Cool. Okay. Now let's go take a look at the kidneys, because this is something we need. We're scrolling down to K for kidneys. Are you there?
Yes, kidney and bladder.
You got it. Let's click on kidney and bladder on the herbalhealthreview.com, and here we are, kidney and bladder, and it's giving you an overall. You know, look there's the kidneys. It gives you a picture of them. And we're going down the lane, and it talks about polycystic kidney disease and all about the kidneys here. A lot of good kidney information, and then it talks about some alternative health treatment for kidney disease, include and adding calcium and magnesium. There it is again. It's needed twice. You see that? It plays a role in the heart. It plays a role in the
kidneys.
Yeah, because that's the second time. Now it's asking for some amino acids. There's a multiple amino acid there. Oh, and and the kidneys are wanting some enzymes to break things down. And of course, that's what amino acids are. Amino acids are proteins. You know, you eat some protein, and then you have to break it down. Your liver has to break it down and make an amino acid out of it, and then your body can handle it better, and the kidneys can handle it better. Well, if you bypass the work that the kidneys and the digestive tract, the liver, has to do, if you help the digestive tract and the liver and the kidneys by taking amino acids, it's bypassing all that work and feeding them and making them very happy. So when you give them calcium and magnesium and some amino acids, a multiple amino acid, and then you add enzymes to where they can digest it and break it all down even further, and then you make sure they're getting the most important minerals like potassium and lots of super green foods. And then it lists here a liquid multi-intramax. That is a multiple, all organic, 415 ingredients in this one container, and it is a liquid that you hold in your mouth for a few minutes in the morning, like a half of an ounce, and you hold it in your mouth. It goes in sublingually. You get 300% of it, or more, because it's got some other precursors in it, so you're probably getting more like 350, just because of it has it has more like a lemony kind of a fruity kind of a flavor that makes you makes you secrete enzymes in your mouth. So you're really breaking this stuff down, and it's going into the bloodstream immediately. It's 415 ingredients. It's the best multiple vitamin in the world. It is called Intramax, and by taking that, and it's a doctor's only. You can't just walk into a health food store and get it. They're not supposed to sell it over the counter. However, you can get it from us because we are a ministry, and you have and you're getting it by a doctor's recognized facility.
Wow. That's awesome.
So you now have availability of the best multiple vitamin in the world. You take a half a capful in the morning. You take a half a capful in the evening. Don't take it too late at night because it could give you some energy and you won't want to rest. So we want to take it earlier in the evening. You know, when you've gone through the day and you come home and you're kind of tired, and you take you take a half a capful of this stuff and it rejuvenates you. Okay. Now, so all those kinds of things are going to help the kidneys. Now we really get into kidney support, because additionally, when there's kidney disease, very often there's an anemia. The blood is not strong enough. You don't have enough iron in your blood. And you certainly don't want to go to a doctor and get their fake iron pills that give you constipation. You don't want that. So you get an herb like Anemia Relief that has yellow dock in it, and the yellow dock is 40% natural iron. So now with the 40% natural iron and all the other nutrients in there that are all really super, there's alfalfa in there, there's kelp in there, there's all these minerals and vitamins and dandelion root and so forth, and it's just a wonderful formulation that supports complete iron health and gets rid of anemia. So that's a good thing to know about if there's kidneys, because very often the two go hand in hand.
Right. I have a question. Since he's on medication now, what's your recommendation? Taking these things, heart support, even the liquid multi-Intramax, along with the medication. When do you know that he can, stop the medicine? At what point will that become evident to us?
Okay. See, this is where you need a physician who isn't biased towards nutrition, because if he is, then you can't work with him.
Right.
But if he isn't, then what you need is people working together. And so, because what should happen is that little by little, they're going to need less and less medication, and so they're not going to need the medication, and as the herbs do their job, and the body takes over its natural healing capability again, and isn't being poisoned by some synthetic drugs that you need this drug because that drug gave you a complication, then you need 4 other drugs because of all the other problems you're having now because of those 2 drugs, and on and on and on. It's a yellow brick road to hell.
Right.
So you're getting away from the synthetics. You're letting the body use what is recognizes since the beginning of history, since man made us, the plants. That's our medicine. That's our food. And as we allow that to happen, the body goes back to work, and the healings take place from the Most High, and the body goes back to work again, and it's a slow process sometimes, and it's a fast process sometimes. We never know just how this is going to work. Very often I have people calling me up with kidney cancer, kidney disease, and so forth, and they tell me that when we give them the CF cancer, kidney cancer formula, that after 1 week, the cancer is gone by 25%, because they're doing all the other things for the kidneys and taking a cancer formula, and by 2nd week 50% is gone. By 3rd week they can't find it. And that's with pancreatic cancer as well as kidney cancer. I'm getting those kinds of reports. I'm not making claims. I'm just citing, reports of what people are calling me back and telling me that this is how it's working. So now as you go through here, you see that that anemia relief is going to help the kidneys excrete wastes. And then you're also seeing that pomegranate concentrate, which has antibiotic properties, helps to acidify the urine, and celery, good old stalk of celery, which works as a diuretic, helps to decrease the uric acid. So you make sure you get celery in your diet. Some pomegranate concentrate. And also parsley, which works as a diuretic to decrease uric acid. And then hydrangea, which cleanses the urinary tract, and uva ursi, which has germicidal properties that cleanses the urinary tract. So now you've got, if you start putting all of that into play, then you start, if there's stones, we're going to deal with the stones. And if there isn't stones, well, then we don't have to deal with them. But if you think that there may be some or have any symptoms of it, a stone cleanse is not a bad idea. But anyway, the main herb for the kidneys is marshmallow root powder. Do you see that? Mm-hmm. The marshmallow root powder, anybody who has a kidney disorder should be taking boiling a quart of purified water, or distilled water is okay in this case, and or RO water, purified water, distilled water. These waters can be used boiled, and once you do that, then take a tablespoon of marshmallow root powder, put it in the water. You're taking the boiled water off the burner, and you are stirring the marshmallow root powder up there a little bit, and you are putting the lid on it, letting it cool down. Then throughout the day you have 1 quart of marshmallow root tea, and you sip on that throughout the day and finish it 2 or 3 hours before bed, because we don't want to do anything more for the kidneys in the evening. This will train the kidneys to strengthen the kidneys, and within 3 to 6 days normally, not any more than that. If somebody's wearing a diaper with incontinence of urine, they can throw their diaper away. Wow. Because they don't need it anymore. It strengthens the kidneys and feeds the kidneys. It's the perfect food for the kidneys, just like the perfect food for the liver is milk thistle seed powder. You can take the extract. If there's a severe kidney problem, we're going to give you some extract, but we're also going to give you the powder. Whenever I make a smoothie drink, I put in a big tablespoon, maybe even 2 big tablespoons of milk thistle seed powder in my smoothie, because it will regenerate the liver by 60% in 120 days. Wow. Yeah, so there's a healthy liver. And when you've got a healthy liver, healthy kidneys, then things start working. Now,
right.
Let's...
Question.
Yes.
So how long can somebody drink the marshmallow root tea, for instance? Is that something ongoing that you can just drink for the rest of your life just to promote healthy kidneys?
Yes. Yes, you could. You could. But after you've rejuvenated them, and they're back to capacity, you really won't need to drink maybe a quart of it. Maybe now and then you'll need just have a cup of it. Yeah. See, that's what happens. What happens is the body goes back to work. And I've personally talked to a lot of people who call me back and tell me that they were going to go on a dialysis machine, or they were on dialysis and came off of dialysis, or didn't have to go on a dialysis machine because of knowing about just the marshmallow root tea thing. Now, there are, you know, if there's a problem, you know, with spasms, then we can use kava kava. That will stop any spasms in the kidney bladder. And if there's stones, you see there's a stones clear. You put 30 drops of that. That helps to get rid of stones. And it wouldn't hurt if you did it anyway. If you don't have them, it's not just going to get rid of nothing. But if you do have them, it's going to get rid of them. And 30 drops of schizandra berry in this mixture, this you know, 3 times a day. Because if you're drinking a quart of this marshmallow root tea, you're having more than 3 cups. But at least with 3 cups of it, you're putting 30 drops of schizandra, 30 drops of stones clear, 30 drops of kava kava. If you have any of these kinds of symptoms and want to deal with that kind of a thing, because the schizandra berry protects against free radical damage and viral and bacterial infections. So if someone's prone to UTI, urinary tract infections, they want to know about schizandra berry and marshmallow root powder.
What do you recommend for a, I guess, a weak bladder in a sense? Like, if you always have to go to the restroom, like as soon as you drink something, you have that urge and that feeling to go. What do you recommend to strengthen the bladder?
That's it. That's called incontinence of urine. And that's exactly what marshmallow will defeat within 3 to 6 days.
Wow.